Dry her off.
Okay, you're going to put the baby under a radiant warmer. Or you're going to put the baby skin to skin. Skin to skin. Because what does the skin to skin do?
Warm.
Warm them up. Okay. So either skin to skin or under a radiant warmer. Then you're going to wipe the baby down. Dry the baby really good. Make sure the neck, under the arms, the creases in the legs. Why?
That's
where they
moisture.
lose heat.
Oh.
That's where they lose heat. So get that stuff dry. Then with the wet towel, do you leave the wet towel on them?
No.
You take that off, chuck the wet towel, put a new blanket under them. If they need to be stimulated, you can stimulate. You can tap their feet, flick their feet. I see that. You can rub their back. Don't shake them. Why? You can't shake a baby. Okay? So you can flick their feet. You can do this. I've even seen nurses that do the sternal rub a little bit if they need to be. Okay, so what else? Maintains airway and suction. All right, so baby's having a hard time breathing. Depress this first before you don't. I don't want to see this. If I see that, you're filled. Okay, so depress it first, then stick it. Do I do nose or mouth first?
Mouth.
Okay, mouth because why?
Because nose.
Babies are primarily
Mouth breathers.
mouth breathers. Then you do nose, other nose, squirt it, okay? So airways patent. If they need oxygen, make sure that your connections are connected. Would it be any good for me to put this on here for the baby?
No.
Because it's not connected to oxygen, which let's say that this is our oxygen back there. So I just connected the oxygen. I turned it up to about 5 or 6 or 8 or 10 or whatever, and just give the baby blow-by. Blow-by means that you are fairly close to the baby. You can also take that off and give blow-by this way. You don't want it directly on them, but blow-by means that when they take a deep breath, that it is an oxygen-enriched environment. Okay, bag and mask. If the baby needs resuscitation, you're going to do the bag and mask this way. Okay? All right. So oxygen observed for general condition and any major anomalies. So diapers are never on the baby when we first get the baby. Did you guys know that? They don't come with diapers. They don't. It's really weird that way. Okay. So as you're drying and as you're assessing, you're looking for Mongolian spots. You're looking for any redness, any smell. You are counting toes and fingers. And you're making sure that they have all of the things. You're making sure that when they breathe, their breathing is the same, not paradoxical breathing. You're looking at their color. If their color is this nice pink, that's good. Babies will usually have circumoral cyanosis. Have you guys ever heard of that?
Mm-hmm.
Circumoral.
Around the mouth.
Circumoral.
So that is normal?
That is normal. They will have a little bit of the circumoral.
Oh, on our same sheet.
Sorry, it's not. Not
It's-
circumoral. If the baby
Peripheral.
has the circumoral, then you're going to have to give oxygen. If the baby has the peripheral, it's normal.
Hands
It's in the hands and feet.
Okay.
Sorry. Oh my gosh. See, I haven't done babies forever. Wow. Okay. So you're checking for major anomalies. You're checking for the cord. How many vessels?
3.
3 is normal. 2
Arteries.
2
arteries,
arteries,
1 vein. Okay. You're checking for eyes if they're opening and closing. You're looking in their ears to make sure there's no blood or drainage. You're looking at genitalia, and you're making sure if they urinate or if they have a bowel movement. Those are things that need to be documented. Okay. Are they having trouble breathing? Then you're going to verbally indicate the APGAR score at 1 in 5 minutes. When we come and do simulation, it is very in-depth. We do this whole simulation thing. We do give the baby APGARs. The baby's actually breathing and colored, and we'll give the baby APGARs. It's really fun. Our simulation day is a great day. Obtain a baseline set of vital signs and records. Do you guys all know how to do a heart rate?
Mm-hmm.
They all have to be, heart rates need to be done apically. Their first heart rate needs to be done apically. So you'll get the stethoscope. You're going to listen to all of the, and I think we've done this in some of our stuff before. So you're going to listen to the baby. Pulse oxes are usually done around their foot. So they take the little sticker thing and they just wrap around this outside part of their foot. They wrap around a little posy to hold it on. And that's how they do pulse oxes.
She was saying around the big toe.
I've only
No.
seen them around her.
They usually do
That's
the
what
round.
I thought.
The big toe is more for if they're 2 or 3 months or something like that. Because most of these babies, yeah, it's just around the side of their foot. Okay, let's see. So vital signs, temperatures. The first temperature is done how?
Rectally.
Rectally.
Oh, rectal.
Their first temperature is done rectally, and you have to be really careful because you have to make sure that the anus is patent. Okay, so first temperature is done rectally. I hope I'm not telling you guys all
You're
of this
doing it
stuff
right.
wrong.
IHC does it different.
Do they?
Well, and the
Yeah, they
movie
do it.
said one thing and the book said the other.
Yeah.
The,
I think Gunnison does that too.
the movie said you don't do it rectally until you bath the baby.
Yeah.
And the book was saying the first one was rectal.
Yeah. So it's kind of hard.
I'm sorry.
Oh, no.
I
We'll
know
just
in
have to ask
Payson,
her for sure.
I know in Payson they do the
Rectal?
rectal.
Like
Because
as
they
soon
were
as
just saying
baby's
you
out,
don't
they do
want
that.
any.
No,
blood.
not as soon as it's out. I mean, if mom wants to bond and breastfeed and whatever. But when you're doing the initial assessment, they will do a rectal temperature.
Okay.
Or if they think the baby's cold. But in the meantime, this baby right now, come and feel this baby because it's been under the radiant warmer. It's warm.
It is warm.
Okay, so what happens when I'm over here and I'm doing all this stuff with the baby? Who's getting the warm? The back of my head. And the baby's not. So make sure that you are standing back and that the baby is getting the heat. Okay. All right. Administers eye prophylaxis, which is
The eye ointment.
The no, it's not the vitamin K, it's the,
erythromycin. So they get the erythromycin because erythromycin kills what?
the gonorrhea.
The gonorrhea and the chlamydia type thing. Okay.
So they're just like little strips that you just wipe.
No, it's an ointment. You just
ointment?
open it up and
Oh, okay, so
Big
it's
old
like a.
goopy
and then it
ointment.
looks
Then
like
you can let it-
Vaseline. Yeah.
Oh, okay.
It's just an ointment. Okay,
Looks nasty.
vitamin K injections always go, most facilities put them in their left leg.
Oh,
That's just kind of standard, they usually do the left leg. Now that I say that, Payson's changed it to the right, I don't know. But they usually just do it in the left leg so that everybody knows if they have a reaction, it's in that leg, that's what it was. So vitamin K, measures weight and length, you guys know how to do that? Okay, if you've got a baby on a scale, can I measure the baby like this? No, I need the hat off, right? Babies need to be totally naked. Or if they already have a whole bunch of tubes on them because they weren't breathing, you need to weigh the baby and then you'll need to weigh the tubes and the things like that so you know the exact weight of the baby. Why do we have to be so careful with the weight of the baby?
weight loss.
Because medications and everything like that is based on weight and height. Okay, so then you've got your this. You always do circumference of the head, circumference of the abdomen, and do you do that in inches or centimeters?
Both.
Okay, usually centimeters is how they do it. The length is usually in inches because everybody wants to know the length of the baby. And they usually, when they do the length, they go from the heel of the foot and they go down the leg to there. Then they take the leg and go up to here because you have to make that turn. So this baby's about 22.5 inches. Okay? Okay. Make sure that the mom's bonding. Okay, the fontanelles, you fill the posterior, the occipital. The occipital grows back within 18. Oh, sorry, the top one's about 18 months. You're gonna feel for caput or a cephalhematoma. What's the difference?
The cap that goes over the bones.
The suture line.
And a cephalhematoma
Doesn't cross the
is
suture.
divided by the bone structure, okay? So you can feel for that, and most of the time you'll be able to see those. But if she pushed for a long time, lots of times you'll feel a caput. Okay, you're gonna check for eyes. Molding is when they've got like the cone heads, and that's just the head molding. Within a couple days, that'll be back to normal. Check ears for alignment, patency of nares, sucking reflex, intact palate. Epstein pearls or milk teeth.